Hello, everyone. I'm Dr. Vincent Camus. I'm working as an attending in the Department of Hematology of the Henri-Becquerel Center in Rouen, France. And I will discuss today the optimal frontline immunochemotherapy for primary mediastinal B-cell lymphoma. During this ICML 2021 meeting, we had two communications related to the frontline treatment of primary mediastinal B-cell lymphoma, and I presented one of them on behalf of my colleagues from the LYSA group. As you all know, primary mediastinal B-cell lymphoma is a rare extranodal entity of aggressive B-cell lymphoma that typically affect young, mostly female patients in their third decade with a large mediastinal mass and an overall good prognosis. PMBL shares histologic and genetic features with classical Hodgkin lymphoma, and clinical trials typically exclude PMBL patients. As a result, physicians use a large diversity of first-line treatments with, for example, standard R-CHOP or dose-dense ACVBP or EPOC or autologous stem cell transplant as a consolidation. In addition, radiotherapy is historically used to consolidate response after injection, but it may augment the risk of secondary malignancies and coronary heart disease. Therefore, we still debate on the upfront standard of care. This situation led us to perform a large multicentric retrospective study in 25 LYSA centers in France and Belgium in order to describe PMBL patients' outcomes after first-line treatment in real-life settings. We compare data from 313 patients treated with ACVBP or R-CHOP delivered every 21 days or every 14 days. We observe that centers typically choose to treat the patients using two different strategies. First strategy was ACVBP or CHOP14 induction with optional ASCT according to interim PET results. And second strategy, probably chosen for elderly patients or patients with comorbidities, was standard R-CHOP21 6 to 8 cycles with no consolidation with ASCT. The main result of this study was a 5-year progression-free survival probability of 89% in the ACVBP and CHOP14 group versus 74% in the CHOP21 group. In addition, no deaths occurred in the CHOP14 group. The OS and PFS results of the CHOP21 group were inferior to ACVBP and CHOP14 group, despite patients in the CHOP21 group displayed less aggressive disease with low IPI and more frequent normal ADH. Regarding safety, patients generally tolerated both treatments very well, but ACVBP led to an excess of febrile neutropenia and mucositis as compared to R-CHOP. Regarding PET scan, in this study, we were able to centrally review the baseline PET scan of the patients and to evaluate the metabolic tumor volume. We observed that patients who had a metabolic tumor volume greater than 360 centimeters cubed had a poorer prognosis in terms of progression-free survival, regardless of the treatment recipe, which confirms the place of a PET and metabolic tumor volume as an important prognostic factor. So during this ICML 2021, our colleagues, Dr. Martelli, report a second study related to frontline PMBL treatment from the International Extranodal Lymphoma Study Group. This communication was related to a preliminary analysis of the ELSJ37 trial, and the authors report outcomes after several induction regimens. Several dose-dense or dose-intensive regimens such as EPOC, MegaCHOP, MACOP, or R-CHOP14 were compared to standard R-CHOP21. 3-year overall survival was 95% in the whole population, but 25% of the patients in the CHOP21 group had a positive PET scan with Deauville score 5 at end of induction as compared to less than 10% in the other intensive arm. So the authors established that CHOP21 is inferior to dose-dense or dose-intensive regimens. Nevertheless, progression-free survival data and data from the randomized comparison between consolidation radiotherapy and observation after frontline chemotherapy are still awaited. To conclude, we may say that PMBL patients treated with dose-dense immunochemotherapy without radiotherapy have excellent outcome, and this treatment scheme should be the standard of care. Now, the LYSA group proposed the following frontline treatment in patients with PMBL, so R-CHOP14 induction 4 cycles and interim PET-driven consolidation strategy based on the gained trial results. We are now implementing a multicenter prospective study in the LYSA centers, so-called Camus study, sponsored by Rouen, and which aims to measure the molecular response at the level of circulating tumor DNA in plasma samples from PMBL patients, and we will compare the respective predictive values of circulating tumor DNA and PET scan after 2 and 4 cycles of ACVBP or R-CHOP14 in order to identify primary refractory patients earlier and to avoid overtreating patients who would keep a false positive PET scan at the mediastinal level. Thank you for your attention.